Do you have pes anserini bursitis and you've been looking for active release? Active release, I'm going to show you a demo today of how we do it on the gracilis muscle in cases of pes anserini bursitis. Now when palpating the gracilis muscle, usually I start at the pes anserini. Again, I'm a little higher than that here, and I'm moving up to the medial aspect of the knee, and I'm going all the way up into kind of if you're going to just draw a straight line from the knee to the groin, it kind of follows that distribution. And it's a very strappy-like muscle, so you can kind of feel it wiggling underneath your finger. I would work all the way up into the actual muscle with this one as well. What do you call a productive fish? And you'll see as I'm actually moving into extension with the knee, I also drop the hip a little bit as well, just because it is an adductor and also it flexes the knee. Efficient.
I like that one though.
And as we start getting away from the tendon, we start working up into the belly of the muscle. It's usually tender on people on here as well, especially when you get a little bit higher, so it's important to realize there are neurological vascular structures in here as well. There is the adductor hiatus, which is a little bit more to the front side of the thigh, but either way, people are usually really tender. So it's really, really important to be super careful. I don't suggest anybody really work on this on their own. They should go to someone who's really experienced in myofascial release because there are nerves, vessels in the area which can be really irritated. Now we were just doing a pin and stretch style technique. This is more of a stripping one. Notice that I'm not moving the knee anymore and I'm holding her leg into a position where she keeps the gracilis actually more relaxed so I can get into it a little bit better. You can do this from a sideline position as well, but as long as she's holding her leg up into the air actively, it's really hard to get into the muscles. So usually I won't do on pants like this, I'll do on the skin, and I'll put some lotion which is a little bit more oily to be able to get some slide amongst the tissue. But the goal is to be able to separate the gracilis from the areas around it.